There is a specific rite of passage that happens when you turn 65. It isn't a party, and it definitely isn't a cake. It's your mailbox suddenly exploding.
Oh, absolutely. The flood of flyers. It's aggressive. You'd think you were the most popular person in town, but really, everyone just wants to sell you insurance.
Exactly. And the confusing part is that they all sound amazing on paper, but underneath that marketing noise, there's really just one massive decision to make. It's the fork in the road: Original Medicare versus Medicare Advantage.
That is the decision. And honestly, getting this wrong is where most of the frustration comes from later on. It's not just about money. It's about how you want to access healthcare for the rest of your life.
So let's cut through the alphabet soup. We have Original Medicare on one side. How should we visualize this?
Hmm. Think of Original Medicare as the a la carte method. It's the classic government program. You have Part A for the hospital and Part B for doctors. But, and this is the kicker, it doesn't cover everything. It usually covers about 80% of costs.
Which leaves a 20% gap that could bankrupt you if you have a serious issue.
Precisely. That's why people on Original Medicare almost always buy a Medigap policy to plug that hole, and then a separate Part D plan for drugs. You are piecing together a suit of armor.
That sounds expensive and complicated to manage.
It can be pricier monthly. You have separate premiums for Part B, the Medigap plan, and the drug plan. However, and this is massive, you are buying freedom.
Freedom in what sense?
Nationwide access. If you are on Original Medicare, you can see any doctor in the United States who accepts Medicare. No networks, no asking for permission. If you want to go to the Mayo Clinic or a specialist 3 states away, you just go.
Okay, that's a strong selling point. But then we look at the other side of the fence: Medicare Advantage. These are the plans advertised on TV with the celebrities, right?
Right. This is Part C. Think of this as the all-inclusive resort model. Private insurance companies take over your Medicare benefits. They bundle everything Part A, Part B, usually the drug plan, all into one card.
And usually with a much lower price tag.
Often $0 in additional monthly premium. Plus, they dangle the carrots. Dental, vision, hearing, maybe a gym membership. It looks incredibly attractive on the surface.
I sense a but coming. There's no free lunch, right?
There is never a free lunch. You are trading that Original Medicare freedom for advantage convenience. The trade-off is the network. You generally have to stay within their list of doctors. And the bigger issue, the one that really catches people off G,